Hi everyone, I am Dr. Anu and I am here to discuss with you about a very relevant topic in pediatrics. It is a must know thing for all the practicing pediatricians and also it is an important question for your exams. So let us discuss about the anticipatory guidance in adolescence. So in this video, we will be discussing about the burden of the problem, the issues that needs anticipatory guidance, about parenting, about the body image issues and other concepts as well. So let's get started with the video. If you want some similar videos or if you want other topics from pediatrics, you can leave it in the comment section and please subscribe to my channel and also like this video if you find it useful. So let's get into the subject. So we know that adolescence is a phase in childhood between 10 to 19 years. So it's like a transition from a child to adult. So it's called adolescence. And this is a phase when the child actually gets a lot of physical changes, emotional changes, and they have a rapid growth both in cognitive and psychosocial aspect. And it is an important time for laying the foundation for good health. So why is it important to know when to guide our adolescents? So you know that India is a large country which has very huge number of young populations, and in fact every fifth person in India is an adolescent. And as the rapid changes occur in the body and the mind, this adolescents will actually go through an identity crisis and they feel emotionally overwhelmed. And as pediatricians, it is our duty to make these adolescents and their parents understand about these changes that is happening in their body. So children who hit puberty will feel uncomfortable about their body changes, which results in self-consciousness and anxiety. As the hormones surge, sexual feelings arise and thoughts about a sex can trigger a feeling of guilt in an adolescent, and parents of the adolescents experience the increased parent-adolescent conflict, stress and emotional distancing with their children. So anticipatory guidance, what do we mean by this? So anticipatory guidance, it's a proactive counseling that addresses the significant physical, emotional and psychological development changes that will occur in an adolescent during the interval between a health visit. So whenever you meet a adolescent in a pediatric clinic, we are expected to tell them in detail more about their adolescent and the changes they are going to face, along with treating the disease condition with which they present. And it can also be introduced to parents and the children. This counseling can be given to them during their vaccination visits. So what are the issues that needs an anticipatory guidance? So you know that preventive health issues like safety issues, substance abuse, sexual relationships and abuse, suicidal ideation, all these require anticipatory guidance. And emotional behavior, normal emotion changes, parenting, anxiety and depression, health and lifestyle changes like body image issues, diet, sleep, exercise, screen time, hygiene, regarding the immunization. So about all of these, we are expected to talk to the parents and the child, and not the child, the adolescent, regarding all of these. So how do you identify whether an adolescent is having a problem? So we have an easy tool to assess this. This is called the HEADS assessment. So HEADS stands for home, education, eating, activities, drugs, sexuality, suicide and safety. It's an easy mnemonic, remember HEADS. So in home, you ask who lives at home, what are the relationship you have at home, do you feel comfortable to share things with your parents. You slowly get to know about the child, you create a rapport with the child, slowly get to know about them. And the education, which subject they are interested in, whether they are okay with going to school, are they facing any issues in the school, is there any bullying, who are their friends, and about the eating habits, about their junk food eating habits, stress eating habits, whether they have any consciousness about the body shape or any changes in the body, or the activities they have, what their hobbies are, who are their friends, what do they do with them, whether they spend time on internet and TV, about the drugs. Do you have friends who use the drugs? So you can know who all are using the drugs, so that if the peer group is involved in drugs, there is high chances that the adolescent is tend to use the drug. So all these has to be addressed. Then about the suicide ideation in children, whether they are stressed, whether they had previous thoughts of suicide, and the safety, that is whether the child has any risk-taking behavior, whether they know about the safety things, whether they know about the seat belt, the zebra crossing, all these has to be assessed. This is called a HEADS assessment. This assessment can be easily done on OPD by a pediatrician or even a general practitioner to find the red flags of adolescents and can intervene as early as possible. So if you find a red flag, then the child has to be sent for psychological counseling. So coming to parenting, the first and the important thing that has to be addressed in adolescence. So we know that there is 4 types of parenting: authoritarian, authoritative, permissive, and uninvolved parenting. Authoritarian parenting, this is when the parents will give strict rules for children and there is lack of compassion from the parents' side. So the children will start telling things to the parents in that fear. Then comes authoritative parents, where the parents are responsive and the rules are set and the child is given support to follow the rules. So this is authoritative parenting. Permissive parenting is when the parent lets the child do whatever the child wants. There's no strict rules for children and parents are very responsive. The 4th type of parenting is called uninvolved parenting, where the parent doesn't care about the child, what the child does. The parent shows less responsiveness to the child's need. The emotional attachment in this parenting is very less. So which parenting type do you think is perfect? So studies show that authoritative parenting tends to be good and children tend to do better in their schooling if the child is being reared in an authoritative parenting. Authoritative parenting. So the children are found to do better in an authoritative parenting. So teens raised by positive parenting, they do better at school, deal better with the conflicts and have lower rates of depression and are less likely to develop risky behavior. And imparting life skills and spirituality are a part of positive parenting. So you know that each family is unique and so is each adolescent. So just think which kind of parent are you and what kind of parenting do you want to tell the parents to be. Next, coming to the body image issues. So children are obsessed with counting calories, taking up crash diets, or talking negative about their body. So they need guidance about normal physical growth and development, including the changes in puberty, and they should be focused on what their body can do. So rather than body shaming or telling them that you can't do this because of your body, you have to encourage them on what their body can do rather than how the body looks. Praise the child for what he is, who he is, and what matters more than his shame. So not all of us are completely satisfied with the way we look and feel about ourselves, but we have to know that whatever we can do is actually more than what we actually think. So when should they seek medical help? Absence of breast development by 12 years, absence of menses by 16 years, and if there is no testicular growth by 13 years, they have to immediately seek medical help. So this is a chart which can be shown to adolescent children, and they can be asked on what type of body they actually are. So if a child actually has a body issue, they are thin, but they will point that they look obese. And if you ask them what body shape they want to be, then even if they are like on the right body shape, they will want to be looking extremely thin. So body image issues can be easily detected with these kind of charts. So eating disorders, which were once in the Western countries is very, very prevalent in India. So you have to pick up eating disorders in your OPD. So remember, lips, flips, hips, skips, nips and snips. So lips, are they obsessed about the food? Is their behavior changing? Do they have distorted belief about their body? Are they often tired or struggling to concentrate? Do they disappear to the toilet after meals, or do they start excessively exercising? So all these are red flags to know whether a child has eating disorder. These can be asked in OPD if there is any signs and symptoms suggestive of eating disorder. Coming to safety, we know that safety is very important. Adolescent period is a period when children actually jump into troubles, and as a result of that, WHO says that around 3,000 adolescents die every day. All these are preventable deaths. The top 5 preventable deaths in adolescents include RTAs, pneumonias, suicides, drowning and diarrheal diseases. We know that all these are preventable, so children has to be taught about the road safety rules, about wearing helmet, about wearing the seat belts, about going through the zebra crossing lines, about the traffic rules. They have to be taught swimming, about the safety protective measures. They have to be taught about all of these. They have to be given awareness about suicide, and they have to be shared the helpline number on which they have to contact if they come through any problem. All these has to be told to the children. So pediatrician should discuss the risk of speeding, accident, safety measures, and abiding by traffic rules, use of seat belts and helmets, etc. Coming to substance abuse, ask about the substance use in peers, as I told. Then you can indirectly get an idea whether the child is using a substance. An adolescent with substance abuse may need psychiatric and pharmacological therapy. So why do they try these substances? It can be because of boredom, peer pressure, social anxiety, or because adolescent age is the age where they are ready to explore the world. They try new things, or they boost their concentration and grades, or they think that these drugs can control their weight. Coming to diet, very essential. You know that adolescent is the future adult. So giving a balanced diet is very important. Remember that junks has to be avoided. Iron rich food has to be included. So remember junks. Junk stands for junk food, ultra processed food, nutritionally inappropriate food, caffeinated drinks and sugary drinks. All these has to be completely avoided, and they have to be given iron, because low iron can cause fatigue, tiredness, brittle nails. It can decline in their progression and their performance. There will be dyspnea, headache, lightheadedness and pallor. So iron rich diet, avoid junk, include nutritionally balanced food. Coming to sleep, adolescents need 8 to 9 hours of sleep. Sleep is very important for their proper functioning, and sleep hygiene has to be taught to them. So sleep hygiene includes they have to go to bed on time, avoid screen time before the bed. They have to have a proper routine. They have to avoid caffeinated drinks before the sleep. They have to have they shouldn't have light naps in the daytime. They have to have a sleep friendly environment. They have to meditate before going to bed. This can all promote healthy hygienic sleep. Coming to exercise, exercise should be a routine in adolescence. Minimal exercise, light exercise, so moderate at least 3 times a week for 30 minutes to 1 hour at a time. Excessive exercise should not be encouraged, because they can be because of body image distortion. Sedentary lifestyle carries a strong risk of chronic diseases. This has to be taught to the adolescents. Coming to screen time, it should not be more than 2 hours. Screen time has to be avoided. Balanced screen time with adequate time for sleep, physical activity, study, meals, family time, hobby time. All this has to be there. Only then you say it is a adequate screen time. Screen should be switched off 1 hour before the bedtime. And here I am showing an image. the correct posture of using mobile phones. The neck should not be bent. 20-20-20 rule has to be followed for screen time. 20 minutes of screen time, 20 minutes, take a break for 20 seconds and then look away at an object which is 20 feet away. This has to be there because eyes should not be fixed on the screen for more than 20 minutes. Hygiene issues, they have to be taught about menstrual hygiene, about hand hygiene, about cough hygiene. All basic hygiene is very important. Washing hands, bathing, brushing daily, covering the mouth while coughing, talk to girls about the menstrual cycle. So this is going to give them a positive self-esteem. Other issues like sexuality, suicidal ideation, emotion and social media internet has to be discussed. About sexuality, you have to know that adolescent is going through a change. It's going through a phase where they are going to learn about relationship, love, about the menstruation, about sex and everything. They have to be taught in prior. So it's talk the talk before they walk the walk. So they have to have a clear idea on what each of them is and what is right and what is not right. And they have to be taught about contraception and everything so that they can choose things wisely and not fall into traps. Suicidal ideation, they have to recognize the red flags like anhedonia, about sudden academic deterioration, the emotional disorders like if there is any parental conflict, all this has to be discussed and they have to be sent for counseling. Social media and internet, providers should talk to the adolescent about media literacy, which to watch, what to do, watch carefully, think critically about every video and everything that they find in the social media. So all these are things that has to be imparted to the adolescents. Thank you for watching the video. I have only mentioned the essential things as per the IAP standard treatment guidelines. There are a lot more to talk. If we take about adolescent medicine, there is a lot more to talk regarding this. So we will discuss about this in the upcoming videos. If you have any specific doubt, you can mention it in the comment section. Or if you want more other videos on adolescence or any topic in pediatrics, I am here to make pediatrics simplified for you. Thank you. Follow and like this video. Subscribe to the channel if you want more such videos. Thank you.